Hello, everyone, and welcome to our webinar today. My name is Nerima Wako, and I will be the moderator for our session today. I'm very delighted and excited to have you all here, whether you're joining us from different parts of the globe. Good morning, good afternoon, good evening. Our webinar today is being sponsored by Forum Civ, and the topic for our webinar today is democracy in the times of COVID-19. The challenges, the gains, and the opportunities. I'm really delighted to be able to introduce our panel, which is filled with dynamic individuals. But before I go back to that, I'd just like to talk about COVID-19 and some of the changes that it has made in our individual countries rapidly. Looking at the figures today, I actually saw that we have 29.3 million cases currently, and 19.9 million who have recovered, and we've almost reached 1 million deaths globally. So as much as we've seen our different countries handling COVID-19 differently, depending on the kinds of governments that we have, there's one thing that a few people have been mentioning. Is democracy changing, and have our rights been violated? Some would argue that state-ordered lockdowns have violated our very basic human rights, where to do basic things, just working and socializing, was all of a sudden illegal. And was that something that we would ever see happening in our future, especially considering that it was a pandemic, and many saying that a pandemic might happen again, now even more sooner rather than later. So to get us off started, I'd like us to introduce our panelists, and I'll start off by mentioning those who appear on my screen. And so I'll just call them out by name and ask them to each please introduce themselves. First on my screen, I have Ambassador Caroline Vicini. I'll please allow you to unmute and introduce yourself. Thank you.
Good afternoon, everyone. My name is Caroline Vicini, and I am the very new Swedish ambassador to Nairobi. I've been in Kenya for about 2 weeks now, coming directly from Afghanistan, another country where there are definitely some human rights challenges. Behind me, I have 30 years in the Foreign Service, serving mostly abroad, serving 10 years in the United States in different capacities. I worked for the European Union, I worked for the World Food Programme with the implementing partners that were mostly NGOs. And I'm here, I think, because Forum City is organizing this, but also because my government has a campaign called Drive for Democracy, to defend democracy in the world. Thank you.
Thank you, Ambassador. Next on my screen, I'd like to ask Flavia Kalule to please introduce herself. Flavia, please unmute your mic. Okay, don't worry about it. I'll just go to Rana and then we'll come back to you when we get that figured out, okay? Don't worry. Next, I'd like to ask Rana Taha to please introduce herself.
Thanks a lot for that, Nerima. Good afternoon, ladies and gentlemen, and good afternoon, my colleagues, Your Excellencies. It's a pleasure to be with you today on this panel. My name is Rana Taha. I'm the Peace and Development Advisor for the United Nations here in Kenya. I lost the excuse to say I'm new in Kenya. I've been here for about 9 months now. And I have behind me around 20 years of experience in the United Nations system across the Middle East, Africa, and in the UN headquarters in New York and in Geneva. I'm delighted to be here and look forward to a very exciting discussion around this very important theme. Thank you very much for having me.
Thank you, Rana. Next on my screen, I would like to ask Khalid to please introduce himself.
Thank you very much, Nareem. My name is Hussein Khalid. I was the executive director of Akia Africa. Everyone is saying behind me. So behind is about 15 years of working in civil society. As a lawyer by profession, we've been very much engaged in empowerment and access to justice. So very glad to be sharing this panel with Her Excellency and very distinguished guests, including Taha and Nareem and others, and looking forward to it. Thank you so much.
Thank you, and definitely looking forward to learning from you as well. And now I'd like to ask Senator Hodan. Please introduce yourself.
And good afternoon, everybody. How are you? My name is Hodan Osman. I am a Senate member here in Somalia, Somali Federal Parliament in the Senate. And I have been in this role now 3.5 years. And Somalia adopted a new constitution in 2012, and it went from a central government to a federal. And I represent the Seoul region. And I look forward having discussions with you guys today. And thank you for inviting me.
Thank you for your time, Senator. I know you were in session this morning. And now, finally, I would like to introduce Flavia. I hope now you're able to talk. No. Oh dear. No, I think we still have technical issues. But no worries, no worries. I think as we try and figure out what's happening with Flavia Kalule is actually from Uganda, and she's the team leader of the Women Wing National Unity Platform. She's also a teacher and also a women's rights activist as well. So we're very, very honored to have her here as part of our discussion today. So I'd like us to go into the beginning of our discussion with the brief introduction that I already gave in terms of the amount of change that COVID-19 has brought in our countries, even in our governments, and we can say as much as it's changed in terms of democracy. Even within those periods, we've seen a lot of change in terms of people's movements, from Black Lives Matter to even Brexit, to what's happening more recently in Belarus, and not even to mention what happened in Mali. So even during this period of a few months of 2020, there's been a lot of change that's been happening around the world when we talk about government and human rights. And what is our human right when we talk about access to health? Is the government protecting us when they decide that particular activities are suddenly banned? Or should it be the choice of the people to be able to make those decisions for themselves? So we would be very interesting to hear some of these conversations that we are having today. And so for the first question, I'd like to ask Ambassador Vicini, how has COVID-19 impacted the state of democracy in your mind, according to your opinion?
Thank you very much for that question and for allowing me to start this in what I think will be a very interesting conversation. First of all, it's good to remind our audience that I'm representing a government, so I'm not from the civil society or the human rights defender community, which is a different community with a different role than my own. But as I said in my introduction, my own government is very interested in preserving and furthering democracy not only in our own country, but also globally. And therefore, we have been asked in all the embassies to be very active on this agenda. The government, we have to remember, if we go back to March, the month of March, which is not very far away, but still seems to be so long ago, that there was very little known about this virus. And I think most governments and most people also acted a little bit in panic. There was not really any levels of reference. We were not aware of what this virus would carry with it, whether people, everyone who got it would almost die, etc., etc. Since then, we have not only the doctors, but also we have learned a lot about how this virus is behaving. And I think we have been able to adapt our own behavior to that. So I think many governments reacted somewhat in panic. They acted with very strict restrictions that were universally all over the country, mostly put in. Some countries like Kenya, like Finland, like some others, also restricted the movement within the country. You could not travel from one part to another, for example. There were certain regions that were isolated. And just as was pointed out, by telling people that they could not leave their homes, this was an enormous restriction in people's lives and in our fundamental human rights. Having said that, in my own country, it wasn't legally possible to do that. So we did not have a lockdown. But I can tell you, there was a lot of people that were very critical towards that and said, my government is not protecting me. My government is allowing people to circulate in the streets, keeps open the schools, people who might bring the virus to me, to my family, who might bring death. So it was not an easy question. There's also another issue I want to take up when we speak about governments, just very briefly. It was this initial instinct that it does not come from us. This virus comes from somewhere else. It's brought in by foreigners. It's brought in by others, which also in many communities and in many countries around the world sort of put a spell on people who were foreigners, people who had been traveling. I saw it when in Afghanistan, there was a lot of Afghan refugees that came back from Iran, and Iran was had a lot of people who were sick, and these people who came back were stigmatized because they were supposed to bring the virus. So there were many sort of ugly undertows also, and the Afghan government could, of course, not let its own people in. But many said, why do we let these people in? They're Afghans, but they are bringing the virus to us. So there were many difficult decisions for the governments to make, and certainly it opened also for a lot of abuses. Thank you.
Thank you so much. It's so interesting to hear people arguing the fact that there was no lockdown in Sweden, that they felt that they were not protected by the government, and also the fact that all countries faced this pandemic with panic and fear. So a lot of decisions were made very rapidly. So I'd like to hear from Senator Hodan what she thinks in terms of COVID-19 and the impact that it has made in democracy.
And thank you. For Somalia, the only choice we had was to follow the World Health Organization's guidelines and their recommendations. The government, I think after 3 weeks, and when the United States closed their borders from overseas, and the borders they closed, and they also closed the local flights so that people will not travel within the country. And also they closed all the schools and sports gathering, restaurants, and they also had we only had we had only prevention is better than cure, because our country is coming from a post-conflict. And when we saw what was happening in the United States, what it was decided to do is the government purchased all the ringtones. When you're calling someone, it gives you the awareness of what the virus is and what you're supposed to do. And through the city, the government put hand wash sanitation stations. Since the borders were closed and food was not coming from the ports, the government decided to tax relief to the businesses so that they will not raise the prices for the food. And so far we have about we had 3,389 cases, 2,800 were recovered, and we only had 98 deaths, which is really good because it's all based on prevention. And I'm bringing it back to you.
Thank you. I think a lot of countries also did follow WHO because they just didn't know what kind of methods to utilize when it came to fighting this virus. But there's also an interesting comment that I have seen in the comment box from Isiolo Gender Watch, where they've written COVID-19 has affected economic growth, especially on business, women, doubled up with domestic violence that is on the rise, causing death. We have lost 3 women and 1 man. Pregnancies are on the rise. So to me, it goes back to saying, as much as even Somalia had very few deaths that were caused directly by the virus, we're now beginning to see certain deaths in our communities indirectly linked to COVID-19 and its impacts. And I think that will be very interesting to unfold. I'd like to now go to Hussein Khalid, and I'd like to hear his perspective, which is a little bit different because now it comes from the civil society sector. And what are your thoughts in terms of the impact of COVID-19 and on the democracy? You're on mute. Please unmute.
Sorry for that. Thank you very much, Nerima. And as you know, human rights and democracy go hand in hand. There's a violation of human rights, and democracy cannot take root. And where there's no democracy, the human rights violations are inevitable. So in one way or another, human rights and democracy are directly linked. In the Bill of Rights, for example, in Kenya, which is 4 of our constitution, we talk of universal suffrage, which is the right to choose to have them in places where, as the people, can work with them to ensure the development of our nation, country. And during this COVID-19 pandemic, very many issues were experienced that had a direct impact on democracy. And for our country, for Kenya, the fact that people could not really mingle, the fact that people could not had a direct repercussion on how we view democracy. Many these restrictions were actually put in place, was considered something under the Constitution. So you can argue those are rights. Speak under Article 43 of the Constitution of Kenya guarantees every person the right to care. At the time, it was restricting freedom of movement, freedom to socially interact, stuff like that. The question then was, how do we prioritize these rights? What comes before the other? We know that the right to healthcare has a lot to do with the general public. Freedom of movement, movements had to do with individual spaces and freedoms. That's to an extent we saw that different people had different about the government. Together with corruption tied to it, where now it is emerging that millions of shillings might have actually gone into pockets. This again has a direct impact in the country, because then people now have to choose whether these leaders did the right thing. And as Her Excellency said, many governments are acting in a panic mode. So we don't time put in safeguards to ensure the resources that were being used were actually channeled through the right directions. So we saw gaps in the management of these resources, which is now emerging. That these gaps might have led to corruption coming into place and interfering with the service provision for the local Wananchi. So even as we speak about this, Uganda Article 29 of the Constitution of Kenya, which talks about the right to security, greatly violated. I think many will remember, for example, here in Mombasa, where I'm speaking from, we saw how ferry users were violated, were beaten up by the police on the first day of the curfew, even before the hours of curfew had, before we had gotten to the hours of the curfew. We saw women and children who were battered, who were tear gassed, and they couldn't even make it through the crossing, the channel, the Conif. So again, it has a direct impact on our democracy, because the question people are asking is, how come states is engaged in rights violations is supposed to be the one protecting the rights of the citizens? So again, we come to identifying leaders going to address matters that are very dear to the common citizen. These are issues that always come up. So the COVID-19 pandemic has had a direct impact on democracy. And even as we continue discussing the issue of security, we know for a fact that there have been a lot of social distancing, staying at home, which has meant that many people have now had no other choice but to get connected to the internet and social media. There were no mosques, there were no churches, so there were no just leaders to actually guide the people to know how best to handle much of this, which meant most of the youth now had to rely on the internet and social media, where we know for many years radical elements, criminal elements have used social media to infiltrate the minds of our youth and to misguide them into joining the ranks of violent extremists and criminal gang members. So presently, as we stand today, we're seeing a number of killings and disappearances that are being reported in our communities, and the police are linking them to criminal and terror-related activities. And before the COVID-19 pandemic, we actually felt that we had reached a point where we might have finally addressed matters VE and criminality, because Mombasa, the coast, had to a large extent become quiet again, and we were beginning to see things changing for the better. So with this couple of months now, we are not certain what exactly has been happening, but what we are seeing is signs that are now coming up is that, there might have been infiltration, that the recruiters might have used that opportunity to reach and mislead youth into joining their ranks. So all these are issues that directly on democracy. As I said, democracy and human rights go hand in hand. You can't have one without the other. And if human rights are violated, like I said, then there's a very high possibility that democracy will not be enjoyed. And where there's no democracy, then human rights violations become inevitable. I think I'll leave it at that. Back to you, Nerima.
Thank you, Hussein. I like the different cases that you've highlighted in terms of human rights violations that we kept seeing, especially when we talk about police brutality and even when we talk about vulnerable communities and how they've been treated. I would just like to highlight a comment that I also see from the comment box from Duncan David Onyango Oduor, who basically says that COVID-19 presented an opportunity for governments to bypass the people's rights to participate in governance and development processes, both at the county and national levels. So that's also another aspect that we're seeing, where participation of the people is not necessarily being carried through, but we're seeing things passing in assemblies and going on as business as normal when things are not normal for the public. And I'd like to now bring to the conversation to the fore. And just like to add that if people would like to share their comments, I'll do the best that I can to read them. And we're also using the hashtag defending democracy. So please feel free to share them, and I will try my best to read them during this webinar session. And I'd just like to bring Rana to this discussion and just move the discussion a little bit and talk about stakeholders and how do stakeholders fight back against the rollbacks that have been mentioned by Hussein previously, especially those that we've witnessed and gains that we've made when it comes to democracy in the recent months being taken for granted and being thrown to the side. What are some of your opinions on that?
Thanks a lot for that, Nerima and colleagues. Undoubtedly, when we look at the COVID-19 effect and impact on the society as a whole, on our lives, not only in the health side, but freedoms, democratic space, the impact has been absolutely staggering. And in a way, it had derailed the progress on all developmental fronts, on all political fronts, on all democratic fronts. It has acted as an exacerbating factors for our lives. And when we talk about the democratic space and the effect on the democratic space, my colleagues, Her Excellency the Ambassador, and Mr. Khalid has also highlighted, and Senator Hodan have highlighted the impact that it had, whether on civil rights, but also on elections across the world. We've seen a lot of postponements of elections. I was looking at some of the, like the UN statistics. We have up until July, I think we had around 18 elections or referenda that have been held since the onset of the pandemic, and we have 24 that have been postponed, and 39 elections that we don't know what they've maintained so far, but we don't know really whether they're going to be possible to be held or not. Despite all of this, and we, like during COVID, we constantly talk about the negative effects, etc. But on the role of stakeholders, I want to highlight some of the glimpses of hope that we have been seeing, because clearly, despite all of the negative impact that there is, people around the world, governments, civil society actors, individuals, and groups are trying to organize and to rethink how can we adjust better? How can we address some of these challenges? And this is really presenting a huge opportunity for all of us, because we've seen the sliding on the democratic front, on the civil rights, even before COVID-19 started. So in a way, this offers a little bit of an opportunity to push the debate forward on how can we create fit-for-purpose mechanisms, fit-for-purpose channels for all of us around the globe to address questions of civil rights and democracy. And we've seen, and we want to encourage, the United Nations has been in its own COVID-19 socioeconomic response that has been globally articulated by the Secretary General. We looked at 5 different pillars to address, and one of which is focused on issues related to social cohesion and issues related to governance, etc. And we've seen also under the responses and under the stakeholders' responses to counter the negative effect of COVID-19 has been really an exceptional movement on digitalization and usage of digital spaces to correct some of the shortcomings related to inclusion, because now this is these are the bigger issues. So the stakeholders have come back to us by addressing issues of inclusion, creating more digital spaces that are that are trying to address the question of inclusion, question of accountability, and here I want to highlight the new trend that we are seeing globally, which is the tracking. We are seeing more and more digital forums and digital tools that are popping up to track government and local governance behavior towards democracy, towards issues relating to peace and governance and corruption. So stakeholders have stepped up, but there's a lot yet to be done on inclusion, increasing transparency, reaching out to those who are furthest behind, and these have been the digital divide has been an added element to increase their alienation during this period. So I want to wrap up here and leave you with a note that I feel we are definitely going through a historical period, a historical transformative period that requires us all to step up and to redefine and to think innovatively of how can we redefine our relationship with between the society and the government in a way that increases transparency, increases trust. How can we use trust to do that? How can we use the digital spaces to do that? How can we use digital spaces to increase inclusion, not to increase the divide amongst us? Thank you so much for that.
Thank you, Rana. And I like the last note that you ended on in terms of how do we increase and capitalize on even trust. And it brings me back to the Kenyan example, where even as much as we're celebrating democracy, as much as we have our elections every 4 or 5 years and they become more technologically advanced, there is absolutely no trust. So if anyone was to do a study on the Kenyan people and relying on technology to build trust, I think that we would be a good guinea pig to show that it doesn't necessarily mean that technology equals trust or transparency or accountability. But also, I like the things that you have mentioned in terms of the opportunities, and this being a great opportunity to push the discussion forward. And you have talked about the usage of digital spaces and questioning accountability and tracking, which is another thing where we've been seeing a lot of funding going toward COVID-19, and then a lot of concerns as to how for Kenya county governments have been utilizing those resources. But I would like to also throw a similar question in a sense, in terms of, what are the positives that we can talk about or the innovative trends? And I'd like Ambassador Bichini to answer this, whether there are some new methods or emerging methods that perhaps she has seen in pursuit of democracy, especially during this period, that she might be willing to share with us.
Thank you. I think a lot was mentioned by the last speaker I mean, I think that the main opportunity that we have seen is the increased use of digital platforms and social media for communicating when people have not been able to meet in real life. And that has maybe increased the availability of our politicians, for example, to communicate with civil society, because if you can just sit from your office and be a part of a conversation like this, and you don't have to displace yourself and take a whole day and be physically there, you can spend half an hour or more by discussing with more people. And that's what our politicians have said also, is that they have had opportunity to be in contact with many of their own colleagues and even organizations outside Sweden, just in this very easy way. But I also think that what was being mentioned earlier in this discussion is that the use of internet also opens up for a lot of provocations and a lot of forces that are sort of trying to fill a void that's out there with false information, or information that is shaped in a way as to create conflicts in society, or even criminal activities, etc. And maybe this pandemic has been interesting in another way, is that very few countries have been able to hide the numbers, and it has been a very public pandemic. The WHO has been very active in spreading information. There are just a few countries in the world who have really been able, where the governments have been able to just deny the virus being in the country, when otherwise this is quite common, that governments are just denying certain phenomena that are existing in society, saying that this does not exist in our society. But with the virus, I think we have seen a quite unprecedented access to information on a global level, and a lot of people have been made aware of that you can get information from somewhere else than just your own government or your own community. Thank you.
Thank you. So, just before I bring in Hussein, it's interesting that you talk about how the internet fills a void, and I know that this period was also where they talked about there was so much information about the pandemic, but also very little information at the same time. So there's almost an overload, and people are saying that a lot of it was false information. And Facebook went through how are we able to track that factual information is being shared on these platforms. So who would have ever thought that Facebook would be working with governments and ministries of health until this occurred? So Hussein, I'd like to bring you into the conversation, but let me read a comment that I've seen from Emelda Miere. And she talks about, does the role of the government in defending democracy change with pandemic? We can evidently see that those tasked to uphold and help defend the rights of the common man are the same people breaking these laws. So I'd like to hear what your thoughts are on that, because I know it has been an issue in Kenya in terms of people still campaigning and meeting and gathering and going against the guidelines, but seeing these announcements every single day as to how we're supposed to abide by them. What are your thoughts on that?
Indeed, you're very right, Nerima, and I think the other speakers have also alluded to this. It's quite unfortunate sometimes the very same individuals that we look up to guide us on the straight path and to show us the way, sometimes they themselves are the ones who violate their own guidelines that are issued. I remember not so far back, there was a meme that was going around on social media of how the minister for health, His Excellency Mutahi Kagwe, was in a press brief with, so many people just next to him without masks and all that. And people are asking, well, he is the custodian of social distancing and communicating to the public to strictly adhere to the health guidelines. What's happening to him? He's standing, right next to some of these individuals. But this is the challenge, I think, that we are faced with when we are addressing issues or matters democracy. It's always about how do we portray ourselves to the public. Democracy is about people. It is the will of the people. It is for the good of the people. So again, we do have individuals amongst ourselves who may not be the right individuals to lead us in some of these issues, but we have a situation where they are in positions of leadership. So as a people, then how do we do that? I think there's a lot of issues and jurisprudence is open over some of these concerns on how best to address those in power when they are the ones violating the same laws and the same guarantees that our safeguards that have been put out there. And I think as a people, the best thing we can do is to abide by the law, because the rule of law, if we start abusing the rule of law, then we will have a country that is not guided on any parameters of safety and security. So my response to that is that, yes, indeed, we do have leaders and individuals in positions of leadership who then go ahead and break the same rules and guidelines that were meant to guide us in addressing the matters COVID-19. There is no worse example as that of a leader or an individual placed in a position of trust, and then that person goes on in corrupt manner to misuse public resources. That same individual who pockets money that is meant for the sick, money that is meant for the dead. I don't think we can have a worse example than that. And when such things happen, the only proper salvation we have is to again go back to the law. You use the law, you ensure those responsible carry out investigations, they follow up on those leaders who have in one way or another stolen from public coffers. You make sure the Director of Public Prosecution, the Directorate of Criminal Investigations, they do their job so that these individuals are, one, suspended from work, two, charged in a court of law, and if found guilty, then they do the term. Because as a country, as a people, and I think these issues of COVID-19 funds somehow corruptly being reaching people's pockets is not just in Kenya. We've heard of the same stories in Uganda. We've heard of the same stories in Tanzania. We've heard of the same stories in different parts of Africa, and even beyond Africa, in the third world, in Southern America, in Asia, even in the first world. There are 10 where this issue come up and asking, was this pandemic real, or was it a ploy to, hide behind the health docket to steal from public coffers? We have people who are even doubting the World Health Organization. So these are all questions, the issues that we need to speak to. I think as a community, as a global community, that is, we have been somehow affected by this pandemic in a way that we all seem to be floating in murky waters and not knowing exactly which direction to take. But I know that as humanity, as human beings, we will find a way out. We will come out of this stronger. As you said, pandemics, once they start happening, there's every likelihood that sooner rather than later, something similar might crop up. So the question is, how do we prepare ourselves? As humanity, how do we ensure that such things do not replay themselves? How do we make sure, for example, as a country, that we have safeguards that will stop leaders who are in positions of authority to misuse those positions for their personal gains. And I think if we are able to answer those questions and guided by the rule of law, we will be able to overcome any challenge that may come our way.
Thank you, Hussein. I'd just like to see if we can bring in Flavia into the conversation. Let's see. Flavia.
Hello.
Perfect.
Yay!
So I might.
Finally.
The question that I did want to ask you is, as Khalid has just talked about the way the Kenyan government has been handling this particular pandemic, and our people actually asking, is this pandemic actually real? How has it been in Uganda, in your view, in terms of even leadership and how they have been speaking to the public and how they've been maintaining the guidelines or even the resources around COVID-19? How would you rate the leadership in Uganda in that aspect?
Thank you so much, Nerima, and good afternoon, everyone. I am happy that finally I've been able to join the conversation. My name is Flavia from Uganda, the women leader of the National Unity Platform, NUP, which is the newest political party currently in Uganda that metamorphosed from the People Power Movement of Uganda, which is led by Honorable Robert Chagulanyi Sentamu, aka Bobby Wine. I am the team leader of the women wing of that platform. I'm also currently aspiring as a woman member of parliament for Kasanda district in the central region of Uganda. So this conversation of democracy and COVID-19 has brought a lot for me, has brought a lot of challenges to light for so many people. And I am glad that my colleagues, all the people that have, the panelists that have shared before me, have highlighted these very vividly and candidly. Because in Uganda, for us as human rights defenders, we started asking ourselves key questions. Because in April 2020, this year, the government of Uganda imposed a total lockdown on all of us. And there was no movement whatsoever. By then, we had no case of death from COVID-19. We had a few cases of people who were got with the virus. And so we were locked down. There was nothing that was functional except everyone had to be at home. We were imposed on a curfew and you couldn't move at all and all that. So at first, the community was very scared. Ugandans were scared because this is a pandemic that had seen killing thousands and thousands of people in different countries. So definitely the question that was on all our minds and that was exposing key governance challenges, especially in the health sector, was if this came to Uganda, which is obviously one of the poorest countries in the world, but also in Africa, and we have we have a limping healthcare system. What would we do? What would Ugandans do? Would we be able to survive the turmoil? Would we be able to survive the levels of spread that the COVID was moving with? So people were very worried, and there was very vividly evidence of fear among so many people, but there was also an element of lack of information, like Nerima was mentioned earlier, because so many people didn't know what to do in these cases. We hadn't been faced with such, strange pandemics before. Uganda has had some, what can I call them? Not really pandemics, but has had some health diseases that have come in to kind of affect us in a very, very negative manner, like Ebola, like the nodding disease in the northern Uganda, but we had never been faced with this. So we were wondering what to do. So then there was a lot of misinformation on the internet. So people were posting anything, any kind of things that they wanted to say or they wanted to share. So there was a lot of wrong information moving around. Then the issue of cross-checking and fact-checking for the information that was being posted came to light, because then people started, and there was so much negative information coming in and scaring people further and further. So then we embarked on a process of sharing information that could re-energize people, give them hope, at the same time keep them wishing and hoping that the situation would get better, but also keep them alive, because now the anxiety was about to kill Ugandans instead of the virus itself, you know, and it was a reality. People were really scared and really worried. But of course, when I look at the other challenge that I am looking at during this time, I think there was a lot of goodwill, and we saw the element of philanthropy coming out strongly among our people, because people started giving to each other, especially helping each other, especially helping those that did not have, those that lacked, especially those that lacked food, because of the lockdown. And we know that in Uganda, the biggest percentage, 90% of Uganda's population live on less than $1 a day. They have hand to mouth, you know, be able to do certain things for themselves. They couldn't earn a living, and they couldn't even get the basic things, including food, one meal a day for their families, because of the total lockdown. Now, what we expected government to do was to come out strongly and be able to provide nationwide food relief to at least to most families or all families across, because no one could get out of the house and no one could access groceries, no one could work. So that meant that so many people were at home dying of hunger. Unfortunately, we registered huge numbers of hunger-stricken families. In my country, I saw a number of women that were doing very odd things to be able to support their families. What the government did was to come what the government did was to they gave out food, but to only 2 districts in Uganda out of 135 districts that comprise Uganda. They only gave 2 districts, which they thought were hard hit, because these were the districts which are a bit urban and where the capital city lies, Kampala. So they thought these are the people that don't farm, so they can't process their own food, and they thought the rest of the country had its own food, which was the opposite. Even people in rural areas were struggling because they didn't have, because not all of them are farmers, and so we expected them to give food across. But now I saw women that took themselves to the police and offered themselves to be imprisoned so that they could get meals for their families, because according to them, being in prison and being in jail was a better option, since those people are guaranteed, the prisoners are always guaranteed to food, and yet for them they couldn't get food in their own homes. I saw another example of women who in Uganda here, we have the commonest meal that we have is called matoke in the central region. They are these bananas, but you peel the bananas, you leave the banana peels, and then you cook the banana, and then you get the matoke, which is a very good delicacy here in Uganda. Unfortunately, we never ate the banana peels. But during this lockdown, I saw so many women, families, about six families with young kids, single mothers, who were feeding their families off those banana peels. And they were getting the banana peels from dustbins, from people's dustbins, because they couldn't afford food. The government hadn't given them food, and they needed to cater to their families. So they looked for the banana peels, and they were cooking those and eating those. So you can see the extent to which human dignity has deteriorated during this COVID-19. When I leave alone the hunger issue, I will also focus on the increased gender-based violence in Uganda currently as we speak. One, all schools were locked down, and they are still under lockdown as we speak, because of the COVID-19, which we all respected and which we all liked, because we knew that if a pandemic of this nature, it spreads faster in schools where kids are, and they can't easily follow all the SOPs, the standards of procedures that have been put in place. Wash your hands, sanitize regularly, keep social distance, and all that. They couldn't. So we applauded the government for that. But now that the schools were closed, the other option came up. What can we do to help these school-going children that are now home and have been used to being at school? Now, in Uganda, as we speak currently, by June 2020, we had 163 girls just in Kampala here, Kampala district, that had done what? That had become pregnant during this lockdown. So there was increased teenage pregnancies during the lockdown. It just escalated because these were young girls who were used to going to school, and now we are seated at home doing nothing. But they were seated at home doing nothing, and as a result of hunger, because of the very high impoverished levels in our communities, most of them were forced to do odd jobs to look for food for their families. So the children became the providers in the home because the father was looking around, the mother was looking around. So because of being forced to do odd jobs, they encountered so many men, and in the process they exchanged their bodies to get a meal a day or to get sanitary towels. And so some of these things have increased the numbers of teenage pregnancies. In fact, my biggest worry and our biggest worry as women's rights activists is when schools are reopened, we are going to have very few girls enrolling for school again, because most of them have now become teenage mothers. In July alone, the number escalated to 175 girls in Kampala who were pregnant. In my home area in Kasanda, it is worse because there's even the whole culture of girls not valuing the education for the girl children. And when you look at the current statistics currently, we have the increased levels of gender-based violence in homes in Uganda. So because so many people are seated and cramped up in small spaces, I'll give an example of families which have only one bedroom or even one room for the entire house, and they were told no moving out and down due to the total lockdown. Now, a person who had been encountering domestic violence had nowhere to go. As a leader of the women in NUP, National Unity Platform, I got phone calls from so many young women who were undergoing domestic violence, who were being violated at a very high rate every day, but they couldn't even reach me to come and talk to me. And every day they would call me crying because they couldn't leave the environment where they were stuck there. So as a government, we focused so much on how to prevent COVID-19 while neglecting the bigger pandemics and monsters that have been with us for ages, which had escalated. So we started looking around as women's rights activists for a solution to that, because we saw increased deaths due to beatings, we saw increased torture for so many young girls and women, but we also saw so many families breaking up but still stuck in the same place because they had nowhere to go. So people were living like zombies in households. They were living in fear of each other. So we posed to the government the question of how can we at least have centers, sheltered, gender-based violence shelters during this period, so that the girls or the women could find a safer place to stay, because they had to be removed from the perpetrators.
Flavia? Okay. I was actually just going to say that the issues that you're talking about are also very similar to what we've been seeing in Kenya as well, and also when the churches closed, and how a lot of women find that refuge in churches because safe houses don't exist. And teenage pregnancies are also very rampant in Kenya and in other countries as well. But there's a particular question that came for Senator Hodan. It was from Stephen Okwani, and he basically said, listening to Khalid, interested to hear from Senator Hodan on this. Somalia is investing more time in putting governance structures and systems in place. Question is, how much are young people involved in these processes? Senator?
Yes, sorry, I couldn't hear you. The gains and the challenges and the gains and opportunities. I think two things that we benefited from is first is social media. Thank God for social media. The government had a direct communication with the people, and whether they were locally or they were in the city locally or in the rural, they were using radio. We had the Minister of Health. She did a daily briefing and reporting and the numbers of COVID-19 and also the conditions of the hospitals and what to follow next. And also there was a continuous of text messages and radio radio announcement in the morning, in the evening to remind people. There were a lot of fear because they were based on a curfew. No one could leave their house after 8 o'clock, or no businesses were allowed to open. So people felt like they were in prison. So what happened was, and also closing the malls, a lot of people took it to heart, saying that why are we closing malls? How come we cannot worship God? And we went back to the religion, because even in our religion, there's a time where there was a disease. I don't remember which one was. It was spreading through, and the prophet and his and the group that was with the prophet, they decided to quarantine themselves where they were not traveling. So we used the religion part that helped us to and about the quarantine, and people not to feel they're afraid or they were taken away from their freedom. Especially like a lot of people are looking up to America, Italy, UK, and when they see what was happening, they realize that our country do not have the condition or the capacity to take care of the amount of people if they get sick, and we didn't have enough hospital beds or enough ICU rooms. So they decided to take the matter in their own hands, and by obeying the law and by following the social distancing rules, the daily reminders, and stay in their houses, and also drinking a lot of ginger and putting like doing a self-care basically, because they understood where they line. And also we benefited this time with transparency. The country is has been seeking for debt relief, and the COVID-19 funds were misused by officials in the health department and the health ministry. So 4 individuals were sentenced from 2 years to 13 years. The director general was sent to 9 years and also head of accounting for 12 years for mismanagement and COVID-19 funds. And I think people actually gained some confidence in them, and how the country, how the government was working and was taking action towards to the line of communication and the line of transparency. But one thing and I'm really worried about is last 4 months, and we had raining season, and it's been raining, and also we've been having a lot of floods in the farmland. And food security is huge in Somalia because we already have limited resources, and now most of farm area is been flooded. And we're trying to actually make up the time now, but now we have more rain, and then we are going to have a dry season. So also climate change is also going to be hard on us next 5 months, because we are scared of a drought, and which will reduce and food shortage. And I think that's where we're going to have more problem than a COVID-19. For COVID-19, the country was stable. It wasn't shaken. But now I think the lack of food security that's going to come in line, that will shake the country. And also I'm afraid that the food prices will rise, and also there may be people who will be left out without food. So we'll see when we get there, but that's one of our worries, and I will take it, and I'm done. Thank you.
All right, but then there's a part of the question that you haven't quite answered, because the question was in terms of Somalia investing more in putting up the governance structures and systems in place. Are young people being involved in those processes? What's the young people's engagement?
Actually, the youth has been leading this. We have a COVID-19 center through major cities, and also the youth also has been like taking going to door in the rural area, and also reporting what's needed, and also if supplies are needed, or if food is needed. Everything that's needed is being bring back to the Minister of Health and also Minister of Economics. So, and also the Minister of Humanitarian. So all those three ministries, and along with the Prime Minister's office, they'll be working together.
Okay, thank you so much. I'd like to move to the next question. I'd like to pass this question to Ambassador Vuchini. And just now we go towards sustainability. And what are some cross-boundary linkages and support of democracy at a time when countries are very self-preoccupied, which is understandable considering that we're in a very difficult or challenging period. So what is some of the advice that you can give in terms of how do we sustain those cross-boundary linkages?
Thank you. This is a very pertinent question, and we have seen some kind of you really put it on the spot, I think, because even in a region like the Nordic, among the Nordic countries that has a very long tradition of working together on most issues. We have a common labor market that precedes the one we have with the European Union. We have the right to live in each other's country, etc., among the 5 Nordic countries. All that broke down with the COVID-19 in a way that sort of surprises us all, I think. And all of a sudden, there are different rules in different countries, etc. The same thing we have seen within the European Union, that there has been a total breakdown in the Schengen system, where we could usually travel freely between the countries. And now everyone has its own rules, and it is almost impossible to understand, where can you go, where can't you go, etc. So I think the European Union and even the Nordic foreign ministers and prime ministers are realizing this, that we are on our way to lose something that was very important, and are trying to get a grip on the situation. I think this all goes back to the great amount of fear and really lack of knowledge in the beginning on how to behave in a situation like this. I don't think we have been in our modern society in a parallel situation before. We talk about the Spanish flu and those things, but that was 100 years ago. So I really think that the multilateral organizations can be very helpful. Here you have the East African Community, you have African Union, etc. That is the way to go, to try to first admit that we got into this situation, and admit that we didn't know what to do, really. I think that is what governments need to do. And then emphasize the need to try to build up these structures again, and that this is a little bit like climate change. It respects no borders, and we need to find common ways of handling the situation that might not go away for a while, and also might come back in the shape of some other virus or pandemic.
Thank you.
Thank you.
I'd like to ask Rana as well what her thoughts are on cross-boundary linkages.
Thank you. Thank you so much. Undoubtedly, I think that Her Excellency the Ambassador have really hit it right on the head when she described the regression that we've seen on cross-boundary collaboration and on already freezing or holding off on existing agreements between countries due to exceptional measures. And here I do agree that one of the ways to really revitalize these discussions and bring about that kind of energy on cross-boundary issues and regional collaboration is through multilateral organizations and through multilateralism in general. Today is the 15th of September. Today is the opening of the General Assembly of the United Nations. And with the General Assembly, we know that the international debate around these kinds of issues is revitalized. However, we've seen, and the Secretary General of the UN have spoken about that, we've seen a trend that preceded COVID-19, an attack on multilateralism and derailment of that kind of collaboration. This has been exacerbated by COVID, and I think that we absolutely need to work harder than ever before to re-engage collaboratively as regional blocs, as through international organizations, through regional organizations as well, to address these very important questions and challenges that are going to become even more difficult and more complicated with questions of discriminations and fear of the other, the ones that are coming from outside. So there is, in my view, there is no easy answer to it, except that we need to work much harder as governments, as people, as civil society actors, collaboratively together to use the regional blocs and multilateral systems to address some of these gaps and to deal with these very dangerous concerns.
Thank you, Rana. I just want to now ask Hussein in terms of what Rana has just mentioned, being much more proactive, using a lot more energy toward pushing even development partners in terms of support. Do you feel that today we receive that same support, especially for those in the civil society sector and those who have been pushing for democracy decades before? Is it the same kind of support, or are you already beginning to see a change after this pandemic? Oh, Khalid, please unmute.
Sorry, apologies for that, Nerima. I was saying, definitely with this pandemic now, we do have a new norm, and we shall not be the same again. I think Her Excellency and other panelists, Hoda and Rana, and have very aptly spoke about what the new challenges have been and the advantages and disadvantages of the COVID-19 pandemic and how it has affected the way we do things. And the challenges and the pressures that we get as civil society in terms of pushing forward the agenda of democracy in the country is now even more real. Because we know, for example, if I may give Nerima, healthcare is a primary responsibility of any government in power. And healthcare becomes extremely paramount for any executive in office to deliver as part of its core mandate. If you look at the example of Kenya, healthcare is somehow devolved also to county governments. So the COVID-19 pandemic has meant that many spotlights have been shown on government's preparedness, on government's ability to address matters healthcare. And this, in a way, has pointed out or bring to the fore whether certain individuals in office are capable of delivering health services as required by the Constitution and by the people. So I would say this COVID-19 pandemic, yes, has given a push towards democracy. We shine a spotlight on the healthcare services, on civil society, who we've been in this process of democratizing our country for decades and decades. We are now, feel like there has been more support in terms of urging for good governance and pushing forward some of these issues. And we've seen this very many times where African presidents and African leaders, when they have a health issue, they would just border fights, and we'll see them in Europe or in America or even here in South Africa. But the COVID-19 pandemic, what it has done is to, sort of like raise a challenge to some of these leaders and telling them, you can't run anywhere. We saw, in Burundi, the president who died and the wife who had actually been transported to Kenya for medical treatment. If these leaders had actually invested heavily and worked day and night in ensuring health provision in their countries, we wouldn't have had that fear, saying we are going to die, and the stigma would have been less. So for me, I think, Nerima, just to answer your question, the COVID-19 pandemic has, in a way, helped us as civil society actors to bring to the fore the challenges of good governance and democracy, and to point it out to some of these leaders that we must do better as countries, particularly those in the third world, to improve our health service provision and to ensure that even the common citizen on the ground has access to healthcare as provided for in our constitution and laws of our countries.
Okay, thank you. I'd like to ask the audience to please post up your questions. I want to open up the floor so that we can have some questions coming from the audience, and I'll read them. But I just want to highlight a few comments that have come in during our conversation. One is from Roslyn Orwa, where she says, besides the gains, COVID-19 has also revealed the digital divide, access, cost, especially for rural communities. That's actually something we haven't talked about, and I'd like us to talk about in a minute. And then I would like to read from Frank Kasuku. I agree with Madam Flavia. A recently conducted survey in Kenya shows that 150,000 of our teenage girls have gotten pregnant during this pandemic. And then there's a comment from Wajir Community Radio. The sentencing of Somalia health officials for mismanagement of COVID-19 was the talk in northern Kenya. And we were asking why Kenya COVID-19 millionaires could not be jailed. And then lastly, from Kisumu Progressive Youth, even as we embrace the new normal, both the national and county government must be held accountable for funds set aside for COVID-19 response and development projects by the civil society. So we're seeing a lot of interesting feedback coming from the audience that are also watching this webinar. But then I would like us to now discuss this divide when it comes to digital access, especially considering how the government was pushing for people to work from home, but it's not necessarily possible for everyone, especially Kenya, the population being 75% youthful, 80% of it depends on the informal sector, manual labor, agricultural sector. Doesn't mean that you can work from home. So I'd like to pose this question to Ambassador Vicini, just to hear what your perspective is on that, and if there's a worry when it comes to the gender divide, because there is research that shows that women actually have less access to the internet, and then when we talk about developing and developed countries, also another dynamic that we have to consider when we talk about opportunities for the future. So what are your thoughts on that?
Thank you. This allows me to get to one point that I wanted to make during the whole seminar, but just to come to, as you say, the push for work from home. It has been pointed out even in European societies that, as you say, it's not possible for everyone to work from home. And even some categories of people are forced to be out there. I mean, if you are a bus driver, if you work in a supermarket, if you have these type of jobs where you need to be in the public all the time, and you actually are having much bigger risk to get sick than all those others who can sit at home. So those who are the most essential are also, and not to mention the healthcare providers, are also those who are in having the biggest risk to themselves getting the virus and getting sick and eventually die from it. So it's I don't know how to solve that problem, but it's certainly something that is not. There's not an equal risk for everyone. I think the digital divide is something we see in many countries where there are actually people, or they are of they have people who have lesser income, or people who are living in more rural areas where the internet might not be so well functioning. So even if they have a job where they could work from home, it's not really possible for them because the connections are not that good. But what I really wanted to come to, which I think is one point on the human rights agenda, is that in most countries in the world we have taken the right from the children to learn. That so many children are forced to be at home, where it's really difficult to be able to follow the curriculum that you are supposed to follow because you might not have internet access. There might not even be remote schooling. And I think in many countries, we see a risk that some children that we have managed to get into school will not come back. And I think the risk is even greater for girls, that all of a sudden it's felt that they are needed at home and the schooling is maybe not so important after all, as the government has now suspended it for months and months and months. So I think there will be a huge loss for these children, and it's a loss for their future rights as well, because if you are not educated, it's more difficult to have access to your own rights and defend your own rights. I think this is a huge problem, and actually children are not getting COVID to the extent as adults. In Sweden, we have kept all the preschools, the kindergartens, and the schools, the mandatory schools, open the whole time. And we have not had any outbreaks there, nor among the children, nor among the teachers. This is, of course, a choice that each government has to make, but I think it's one of the first things that should be really reevaluated when you can reevaluate, is to bring the children back to school for their rights to learn and for their future as members of society. Thank you.
Thank you. But before I let you go, there's actually a question that has come for you specifically from Stephen. And he's asking, how is the future investment in strengthening democracy in Eastern Africa from both Sweden and the UN?
Well, a part of the international cooperation we are still providing to Kenya is certainly directed towards human rights and democracy Right now, we are considering the best way, together with our colleagues in the European Union, the best way to support an election campaign free from violence in Kenya, and the best way we can do to support that. We support also different institutions, and we also support the regional organizations, their secretariats, etc. I mean, these African community and the African Union, for example. So we are giving them sort of governance support and support to strengthen those institutions.
Thank you. So I'd just like to go to Hussein on that aspect. Do you have any comment in terms of the digital divide that we're seeing, especially when we're talking about classes being online and not all students being in school in that aspect?
Yeah, let me begin first of all by concurring with Her Excellency and the Ambassador in addressing the issue of the right to education, particularly for children who have been forced out of schools because of this COVID-19 pandemic. And the Constitution is very clear that the right to education is a guarantee, and that anyone below the age of 18 is entitled to being in school without any charges. And so we have definitely violated this right of our children. It's impressive to hear that Sweden did not go to that extent, and they've been able to manage and contain the pandemic without necessarily having to deny the children this right. In Kenya, of course, we've seen, for instance, how the girl child specifically has been thoroughly affected by this, as one of the comments we've received from one of our viewers, over 150,000 teenage pregnancies reported just in a few months into the COVID-19 pandemic. This means 150,000 children who may not be in a position to continue with their normal schooling. This means that 150,000 girl children who now have an additional responsibility besides their education to also take care of a young one. This is something that we must address from a human rights perspective. This is a major violation of the rights of the children. And, when we talk about the digital divide, it's far much worse in the rural communities. If you also look at the statistics of the 150,000 children, you'll find that a large portion of that is actually in the rural areas, where due to lack of technology and other amenities that would facilitate these children to somehow remain in school, either virtually, they are not in a position to do that. So I think this is an injustice, besides the pandemic that has affected the girl child and our children in general. They have suffered double by not being able to continue with their education. And for the rural divide, I think it is very true that as a country, but also as a third world country and countries all over, we have a huge challenge to ensure that we are able to reach out to the rural areas in terms of providing them with connectivity. We've seen how governments have worked over many years to ensure electricity or rural electrification is received in the rural areas. I think the same effort now needs to be put in terms of ensuring digital connectivity, because as I said earlier, there is now a new normal. And I think my colleagues in the panel have also said this. We have a new normal, and that new normal will be anchored on technology, will be anchored on the digital connectivity. So as countries, we must immediately embark on ensuring that there is digital connectivity, particularly in the rural areas, so that we can benefit and we can reap from the new normal that we are now living under.
Thank you, Hussein. I'd like to bring Flavia into the conversation. Flavia, when we had just lost you, but then we did have some feedback about teenage pregnancies, and someone had commented about the high number of cases that we also have here in Kenya. And I know that there's been a bit of a tug and pull because the president actually declared a directive that all these abortion medication or clinics that are private to be shut down. And people felt that he was focusing on the wrong issues. And also, a lot of people do not realize that for Kenya itself, we only have one state-run safe house, and that's a concern for many. Each county should have more than one. And also that we have a care and protection child parents bill that went into the house in 2019. And a lot of people are very unaware about it because they feel that it's encouraging children to become parents. And so when we talk about even teenage pregnancies, there's this narrative that people don't understand the dynamics that are causing this rise. It seems to be appearing, especially in media, that it is actually the child who is behaving badly. We're not necessarily talking about predators or rapists or how the law can protect these children. So I'd just like to hear from your perspective in Uganda. What are some of the avenues that you're using to protect these young girls from teenage pregnancies and some of the solutions that you're looking at?
Thank you very much, Nerima, and my apologies. Today, I don't know what has happened to my connectivity, but that's the digitalization we are talking about and the challenges that come with it. First of all, I want to appreciate the people that are making the comments and giving us the questions on the things that we are talking about, because it's important that we look and we shine a torch on some of the plight of the people that are going through different phases of disadvantages and challenges. In Uganda, especially as the women's rights wing for the National Unity Platform, we are partnering with a number of women's rights organizations to see how we can safeguard the girls and the women that are going through gender-based violence, but also the girls that are getting pregnant due to the result of the lockdown. And so we are doing a lot of sensitizing. The virtual thing has really worked, but we're also doing smaller groups for the girls now to try to engage them, keep them engaged while at home or in safer spaces, to sensitize them on why they need to protect themselves and what they need to do at the time so that they can avoid getting pregnant, so that they can be able to go back to school. But also a key conversation on the policy of, can a girl who has gotten pregnant be allowed back or readmitted to school? You know, that is one of the key conversations we are now having as a country and as women in Uganda, and we want to see how to push this forward to the Ministry of Education. Remember, at some point, the Ministry of Education had talked about being able to allow these girls to get reintegrated in the school activities, to be able to study and complete at least their secondary level and be able to sit for their final exams. But that would have called for services, the health services, like more focus on pregnant girls, antenatal services and all. And so some parents made a lot of noise saying, no, we do not send our kids to get antenatal services and to become pregnant. But the conversation then became, so what do we do for these girls because they are pregnant? And if we want to readmit them in schools, definitely we need to provide services for pregnant people, because we are not going to let them give birth to premature kids or to get all kinds of diseases and hardships that may come as a result of this. But also we are looking at, so if this can be pushed as a policy, having analyzed both sides, I'm sure we can get a middle ground for these girls so that at the end of the day, they can be able to go back to school. I know in Uganda, we have at least one school in the north that was started to be able to cater to girls that drop out of school and get pregnant, but they can easily go back and study even as they are pregnant while attending to antenatal classes and being able to eventually give birth and do other things, so that it's not the girl totally losing out, because the boys continue with the studies. It's the girls that lose out. But we are also trying to skill them economically, so that, because we have learned that most of them get these results, because they are looking for economic empowerment, all kinds of anything, any money that they can use to either get sanitary towels, or whether they can get to be able to get a meal, or even to sustain their families, because we have so many children looking after families, looking after parents, looking after younger children, and so it's difficult for them. But now we have worked with different organizations, and we still lobby different number of goodwill people, individuals, to give us money so that we can help these kids. For example, I know that one of the organizations that we work with, Caring Hearts Uganda, has been able to secure to buy some tailoring machines, which they are training young girls who dropped out of school during this COVID-19, the 3 months, the 4 months where we were in lockdown, the 3 months where we were in lockdown. And they're now skilling them in tailoring, in design, fashion designing, and things like that. Soap making, liquid soap making, and cake making, so that they can be able to earn a living, to earn an honest living with themselves and look after their babies, but also look after their families. Now, Nerima, I want to talk about the digitalization that is the conversation we are having right now. Especially in terms of democracy and governance. Currently, Uganda is going to go to the general election next year. That's in February 2021. We will be going to the polls, and we hope, and hopefully I will be a member of parliament to join Senator Hodan by then in that aspect in my home country, because they will be voting for us next year in February. But currently, as we speak, there's so much uncertainty around the nature of elections that you are going to have as a country, because we still have curfew, so we cannot move past 9 p.m. So whatever you do has to be done between the hours 6 a.m. and 9 p.m. and then you go back. We still have the issue of, remember, elections are entirely about physical meetings. You have to meet people, you have to interact with people, you have to talk to people. And while the aspect of physical meeting comes in, it also comes with crowds. Elections are crowd pullers. But now we are doing campaigns, and next month we are getting into nominations, because I'll be nominated on the 12th of October next month. But we are wondering how we are going to be campaigning. The Electoral Commission hasn't come out clearly on to state guidelines. They simply said we are going to have scientific digital elections. Now, everyone keeps wondering what scientific digital elections are. There hasn't been any clarification around this. And the NRM, the ruling party, National Resistance Movement, just concluded, okay, they are still undergoing their primaries, but they had the hottest primaries. That was for members of parliament a few weeks back. And as they were campaigning for their primaries, we saw them attracting huge numbers of people around them, moving with them very closely together, no following of SOPs. There was no social distance whatsoever. There were no masks being worn. There was no sanitization. All those things were kicked out of the window, and were holding massive rallies past the hour of 10 p.m., which is way past the curfew hour. And the security agencies did nothing about them. Absolutely nothing. In fact, they were under the protection and guidance of security operatives. And yet, here in National Unity Platform, any opposition platform, any opposition party that comes out to do the same thing, even attempt to hold a delegates conference in a very organized environment, following SOPs, COVID-19 guidelines, all that. The moment they get to know that it is anyone from the opposition government, the opposition party, they simply charge in foolhardy with come in charged as the security operatives. The army will descend on you, the police will descend on you, and they will disperse the crowd very violently. And so you find that we are now asking ourselves as leaders for different opposition political parties, is the government using COVID-19 to bang down and to silence the voices of the people, and to violate human rights for so many people? Because especially for people that do not support them, because while NRM are busy doing their business as usual, we have seen them time and time again converging in huge numbers. We have seen them breaking all sorts of rules, and nothing has been done to them. But for us, every time we try to organize even the smallest thing, this can never see the daylight. So we are wondering what the government, government is simply trying to use COVID-19 to be able to clamp down on so many human rights, especially in the governance areas, the right to participating in political processes, the right to collecting yourselves and being able to air your views. But also we see the brutality that has increased. They use a lot of force and brutality while dispersing a few people from the opposition, and they use nothing, absolutely nothing, on the ruling government. So this has just skyrocketed, because before they used to do it, but now anything small that they want to, the moment they want to shut the opposition down, they simply say, oh, you're breaking COVID-19 guidelines. Oh, you're breaking COVID-19. Oh, we cannot allow you to do that because it breaks SOPs. Oh, we can. So you see that there is that whole issue that comes up. When during the lockdown, you also had the issue of courts. So many people, most of our members, we are getting arrested very highly, and it's going to increase even as we move towards the elections, because it's a high fever temperature and we are asking ourselves what you are going to do. But even as they were getting arrested, courts are not allowing so many people in court, and so they were using digitalization, they were using virtual meetings in court, and so they couldn't. So many people's cases were delayed, people's cases were not being heard, people were overstaying in jails and are not being brought to court. They were not being charged with anything, but they were being kept there. So you simply look at all these violations of human rights and you wonder where we are going as a country, because I think there's an excuse of COVID-19 to bang down and to clamp down totally on the voices of so many people that are trying to speak out and seek for accountability. The question of scientific elections, so many of us are still struggling with how we are going to go about this, especially as women, because we know that so many women do not use social media. Majority of women, and each district is supposed to have a woman representative, but most of the districts are in rural areas where you can't even access the internet. But now we are talking about scientific digital elections.
What? Flavia? I'm sorry, we've lost you again.
That means that so many women are going to be locked out in terms of campaign. Hello?
Hi, we had lost you there for
Hello?
a minute. Hello, I can hear you now.
Oh, sorry, I had to switch to my phone. I'm now using my phone, and unfortunately, people keep calling, and I have to keep switching them off. I'm so sorry about that. Okay. So I was talking about the scientific digital elections. The Electoral Commission was proposing that we shall campaign only using TVs and radio, media basically. But how many women can even access media? Even the radio, facts have shown that, and research has shown that most radios and most media houses are owned by the ruling party officials, right, which people are also contesting. So,
oh my gosh. I think now we've lost Flavia. But I was going to say that seems so familiar to what's happening in Kenya, where particular individuals cannot have rallies while others are having very, very big ones. But then I'd like to direct us to another comment, a question that has come in, and I'll ask it to you, Hussein, and it's from Duncan Onyango. And he basically asks, how important is the robustness of institutions, levels of societal trust, and access to information when dealing with a pandemic without undermining democracy?
It's a very tough question from Duncan Onyango. How important are the robustness of institutions? I think they're extremely important. Institutions that we have in place, particularly those that are meant to ensure good governance and democracy is guaranteed, are extremely crucial to such situations. If you look at matters of healthcare, the institutions that we have in place have to deliver to the people, have to make sure that resources are used in the right channels. They have to make sure that the needy and deserving people actually are reached by their services. So such institutions are extremely important. But then we also have the governance and democracy institutions, for example, such as IPOA. So when there's police brutality, when we feel that the police have overstepped their mandate, then these institutions must come in to address the challenges that are witnessed, particularly by citizens. When it comes to issues of corruption, institutions such as the EACC, the Ethics and Anti-Corruption Commission, must speak up or speak out against this blatant abuse of the law, and particularly the stealing from the public coffers. And they must show a good example that as a country we will not accept such kinds of incidences happening ever again. And the importance is not just for purposes of protecting the resources of the common citizen, but it is also of ensuring that as a country, as a people, we introduce or we transform into a new morality which does not allow anyone in a position of authority to abuse the law and abuse the citizens by stealing from them. So I think institutions are extremely important, and as a country and countries in the third world countries, we must always work towards strengthening our institutions so that they can be robust and address the challenges that we face every other day, not only in the COVID-19 pandemic, but any other challenges that may come our way as we continue to work towards democratizing our country.
Thank you for that, Hussein. Thank you for that response. There's also another question that has come in. I'd like to direct it to Ambassador Vicini, and it's from Bobson Fadili. And he's asking, what may be the medium-term and longer-term implications of the pandemic to democracy?
Well, that's a good question. That depends on the public and what we are and the citizens, how we are able to defend this this democracy. I think that there has been quite a lot of focus on the consequences of all these laws and restrictions that we have seen, and it seems certainly that the human rights defenders community is up and reacting to those restrictions. Not only them, but a lot of other institutions as well. But as we were talking about institutions before, of course, strong institutions, good governance is important in sort of normal times, but they become even more important in times of crisis like the one we are seeing or undergoing now. And it's a time when a lot of things are changing. I think what is unique with this is also that there is such an amount of uncertainty of what the future will look like. Will this be over in a few months? Will it be worse in a few months? What will we be able to do? We don't know. What our governments are ready to impose new restrictions, or if they will, even if the situation gets worse, they have learned from before and they are maybe not able for economic reasons to shut down everything as before. So I think this is an unprecedented period globally, because it's also, there is not one continent, there is not one country that has not been hit. So it's a globally unprecedented moment, and it's very hard to know what is exactly going to be the outcome. But I think engagement of this kind is extremely important to maintain and push back against the human rights abuses that this pandemic has opened up for.
Thank you, Ambassador Vicini. I would just like us to, we're coming to a wrap. We have about 9 minutes before we have to close this webinar. And I'd like to give each of you an opportunity to just share your closing remarks or your parting shots, and also maybe even within the response, if you'd like to, I'd just like to hear your perspective on what you think will have to definitely change when we think about after this pandemic. And I think for me, it would be travel. I don't think we're going to travel the same again, ever. And so that definitely means health will be so key to be able to travel in the future. So it would be interesting to me to hear what your thoughts are. And so I'll start with Hussein.
Broken my traveling is one of my hobbies, so that we will not be traveling much as we used to is heartbreaking. But I think that's sad reality. Technology and awareness is no longer need to physically do things. The new normal means we'll be doing much of our stuff, and it's a challenge that the world wholeheartedly in the last couple of months. We no longer need to be physically in cities that in the past have required us to do. So I think also as moving forward to be more tech savvy, particularly those who are not called com generation, we must definitely find better ways of understanding technology we have around us. But more importantly, practitioners, it's how then do we ensure that with this new norms are still guaranteed. As the ambassador quickly explained earlier, each as education for our children, seeing that more and more are now embracing virtual learning. How best will we be able, for example, to share our upbringing, our tradition virtually? Most of the times, these things were done through extracurricular activities. We go camping down with the young ones, share with them stories, particularly setup. And if physical interaction is less and as we have had it in the past, become a very big challenge. But all the same, what I know is that as humanity will overcome this an issue that has come to us point in time, and we will address this as one people and forward as people who are working together for the of all human beings.
Thank you, Hussein. Ambassador Vicini.
Well, I think the human being is a social animal, and we will come back to a time when we meet each other in real life again, and I think that will always be the sort of preferred option to most people. But clearly, we will have other tools that we have discovered to our disposal, and I think those will be used more and more, which will also help us to become more inclusive, because you can have people participating in an event like this. They don't have to travel to Nairobi. They can join from other countries, etc., in a way that we didn't do before. So that is a great advantage. The question is really to try to, even in this new normal, and I think Khaled Hussein said it so well, to see to that everyone is on board on this train to the future. In this new normal, and that means that we need to see that technology reaches more and more people, which will also help them in many other ways in their economic life, in as you say, in maybe getting education, remote education and training, etc. So that is really the positive part of this. But we should be very watchful that different regimes around the world are not taking and keeping the advantage of restricting people's rights to meet, rights to organize, rights to vote, etc. Thank you.
Thank you so much. And I know, Flava, you've just come back in, but we're giving our parting shots. So in maybe 2 minutes, I had asked everyone to give a closing remark on what they feel is definitely going to change after this. So what are your thoughts on that? Very briefly, please.
Thank you, Nerima, and I really want to thank the panelists for the brilliant conversations that I have partly listened to. My apologies for all the technology issues that are happening over my side. But Nerima, thank you for moderating. I think my parting shots would be, I think we have an opportunity of digitalizing ourselves and enhancing our technology during this COVID-19, but we should utilize it well. We shouldn't be like the government that's trying to clamp down currently on our freedom of expression via the internet by imposing more regulations on our social media by the Uganda Communications Commission. I think we need to look at COVID-19 to challenge ourselves and push ourselves better in terms of better organizing. But also as political parties, this has given us something to think about. How do we organize better next during these hard times? But also, how do we work against the pushing factors that are rolling us back in terms of democracy being led, especially by the ruling government towards opposition? I think it's encouraging. I'll just encourage all young girls out there to always believe in themselves, be hopeful that the best will come to them, and not to settle for less, and nor not to lose confidence in themselves for who they are and what they can give, what kind of contribution they can make to their country. In terms of our democracy, I hope that we don't normalize violence, because it's skyrocketing during this time in Uganda. It shouldn't be a normal thing during every election. I hope we can all condemn the monetization of money use of in campaigns, and I hope very much that we want government stops clamping down on opposition's voices, so that we can be able to organize, but also to be able to reach out to our people while keeping the SOPs. This can be worked out. I am sure it can. Thank you so much for watching and for listening, to everyone that has been engaging, and for all the questions and feedback.
Thank you, Flavia. Rana?
Thanks a lot for that, and I just want to end by agreeing with my colleagues and panelists that the world as we know it will no longer be the same, and it's not necessarily going to be a negative world where our freedoms are restricted. It's the world that we will create, and we need to come together and keep pushing the envelope. We're definitely going through a transformative period in human history, and we need to look at it as such. And the current tools and mechanisms for organization, for self-expression, and for governance are maybe not as fit for purpose as they were before. It's time for us to push the boundaries, to look at digital tools for governance, digital tools for accountability, increasing transparency, digital tools for ensuring inclusion. So this is, I want to encourage everybody to look at this as this is a period for transformation, and we need to all work together to push in the same direction. And I am confident that if we come together, and we will overcome all of these difficulties that have been thrown at us by COVID-19. Thank you so much, Nirma, and thank you, colleagues, for this fantastic discussion today. Thank you.
Thank you. And now we've definitely come to an end of our webinar. I just want to thank each and every one of you, my panelists, for even taking the time to share your insights. There are so many things that we've been able to learn and discuss here. And I know that you have extremely busy schedules, so I appreciate your time full-heartedly. And also thank the support from Forum Civ to be able to host this, and the different partners on board, and all the audience who've been chiming into the conversation and watching for the entire 2 hours is no joke. And so thank you so much for your engagement and your participation. Other than that, I wish everybody the best and take care. Thanks.